Welcome to the training on the co-location of a public health alternate care facility with an American Red Cross general population shelter. We appreciate your willingness to work with us as we explore how this concept can best be implemented in our community. The Spokane Regional Health District, the American Red Cross serving the Greater Inland Northwest, and the Medical Reserve Corps of Eastern Washington have been working for the past couple of years on this process of providing two types of services in one location, a concept we call co-locating. The two types of services are essentially the sheltering and feeding of community members during an emergency situation and providing basic medical needs to the same shelter population when appropriate and necessary, instead of sending the shelter clients to an acute care hospital when they do not require that level of medical services. The co-location agreement plan and standard operating procedures were completed about 2 years ago. Since that time, we have held workshops, trainings, a tabletop exercise, and a couple of drills, which have all led up to this full-scale exercise. We have learned a lot along the way and are ready to put our planning into action. The following acronyms or abbreviations will be used throughout the video. ACF refers to the alternate care facility. Red Cross, in reference to the American Red Cross. Shelter, Red Cross General Population Shelter. MRC, used in place of Medical Reserve Corps. Client, person in the general population shelter. Patient, person in the alternate care facility. ICS, Incident Command System. EMS, Emergency Medical Services. This training is designed to prepare you to work in an alternate care facility. The objectives include the roles and responsibilities of volunteers who will work in an ACF. Understand how the client or patient flow works within the shelter or ACF. Understand and use the appropriate forms and documentation within the facility that transitions a client from one side of the shelter to the ACF. This training video will be divided into sections with some supporting visual aids and demonstrations. In this section, you will learn what an ACF is, when and where it might open, and what the roles and responsibilities are for the ACF and Red Cross when we co-locate. An ACF is a type of shelter that is opened by local public health in the following circumstances: when there is a surplus of medically needy clients in a shelter that exceeds the staffing capacity of Red Cross, or lack of bed availability in hospitals or long-term care facilities. Typical ACF patients might have dementia or significant mobility restrictions, require oxygen, or require help with feeding or minor wound care. Persons with more serious medical issues such as fractures, acute cardiovascular issues, or pregnancy complications are not candidates for care in an ACF and should be referred to a higher level of care. The ACF is co-located within or adjacent to a general population shelter, meaning that it is in the same building or close proximity to the shelter, but it is housed in a distinct space. The decision to open an ACF could be made by Red Cross if their medical staff are overwhelmed, or could be initiated by local public health in response to a public health emergency. Co-location allows for a more efficient response to sheltering. With co-location, Red Cross handles the non-medical needs for all shelter clients in both the general population shelter and the ACF. These needs would include dormitory services, feeding, recreation areas, intake, and information sharing. The ACF would handle just the medical needs of the patients assigned to the ACF. Co-location allows families to stay together in the same building, even if individually they have different needs. It also allows patients to move between the ACF and the general population shelter as medical needs change. While a Red Cross shelter is operated by Red Cross volunteers, the ACF is operated by volunteer medical providers that are coordinated through the MRC. The MRC works under the umbrella of local public health. In the next section, we will look at how the ACF is staffed, organized, and supported. As I mentioned earlier, the ACF is mainly staffed by volunteers from the MRC. The ACF team consists primarily of healthcare providers. Support from clients around meals and dormitory services are mostly supported by Red Cross staff or volunteers. The ACF will operate using the Incident Command System reporting structure. The ACF will fall under the operations section if public health has activated ICS. In reviewing this org chart, you will notice the ACF team consists of an ACF medical manager who supervises all healthcare functions within the ACF. A triage nurse is responsible for evaluating any new patients in the ACF and would be involved in any decisions on discharging the patient to the general population shelter or home, or sending that patient to a higher level of care. There would also be a nurse as well as a mental health professional to provide care in the ACF. This team of 4 could be expected to manage 15 to 30 clients in the ACF. Let's take a look at how the ACF is supported by other staff not housed in the ACF. As you can see, the ACF medical manager reports to the ACF branch director, which is a position within the larger public health organization structure. This person could supervise multiple alternate care facility locations. The ACF medical manager is supported by the ACF medical consultant who can provide on-call consultation regarding the patient medical issues. The medical consultant is a physician that local public health contracts with to support the ACF staff. The ACF medical manager is supported within the shelter by Red Cross staff. The Red Cross Health Services Director can consult on health-related issues, while the Red Cross Shelter Supervisor can assist with any non-medical aspect of shelter or ACF operations. Now let's take a look at how the org chart would scale up to handle more patients in the ACF. With additional patients, an ACF supervisor would be responsible for the general operations of the ACF and would directly supervise the ACF medical manager. At this point, the ACF medical manager would only be responsible for medical management issues. A nurse unit leader would supervise the direct patient care staff. There may also be caregivers that come with patients as they are familiar with a specific patient's care. They would also be supervised by the nurse unit leader, even if only providing care for their patient. Spontaneous volunteers or volunteers that are not registered presenting to Red Cross would not be accepted as a volunteer in the ACF and should be encouraged to contact their church or community groups to help out during the current emergency. The next section will cover specific instructions for preparing to volunteer and directions to follow upon entering the ACF. Now that we have an idea of how the ACF is staffed, let's take a look at your first day. As an MRC volunteer, you will be assigned to your first shift by the MRC coordinator based on your availability and the staffing needs of the ACF. During your shift, please wear comfortable clothing, including your MRC scrubs and closed-toed shoes. You should bring your ID as well as a cell phone and charger. When you arrive at the shelter, go to the front entrance and present yourself to the Red Cross volunteer at the registration table and identify yourself as an MRC volunteer. They will have you sign in and direct you to your supervisor, the ACF medical manager. This person will orient you to the building layout, provide you with a job action sheet, and introduce you to the other Red Cross and ACF volunteers on duty. The final section covers the flow and the paperwork of a client transferring from one side of the shelter to the ACF. Every client in the shelter or the ACF will check in at the registration table with the Red Cross. Even clients who were directed specifically to the ACF will check in at this desk, where new clients will fill out a shelter registration form and a shelter intake form. The shelter intake form has a question to see if the client needs additional assistance or accommodation. If that box is checked, then the client will be evaluated by the Red Cross Health Services Supervisor using the Client Health Record form. The Health Services Supervisor will make a determination of where the client should be placed. These options include in the Red Cross General Population Shelter, or in the alternate care facility, or made comfortable while transport is arranged to a higher level of care for additional evaluation or attention. With the decision to admit the client to the ACF side of the shelter, the Health Services Supervisor brings the client and his or her belongings to the ACF area for check-in and triage. The Health Services Supervisor will also bring any paperwork that the client filled out, as well as the Client Health Record form. The ACF triage nurse will receive the client from the Red Cross Health Services Supervisor. The triage nurse will document in the ACF patient tracking form the name, date of birth, and date and time when the client is admitted to the ACF. The triage nurse will then make a copy of all the Red Cross paperwork and give the originals back to the Red Cross Health Services supervisor. Based on the information documented in the patient forms, the triage nurse will conduct a focused history and physical and document any findings in the client health record form. Any additional progress notes will be documented on the notes portion of the client health record. After triage, the ACF nurse, under the supervision of the ACF medical manager, will provide any necessary care or evaluation for the patient while he or she is in the care of the ACF. At some point in the patient's care, there may be a change in health status that results in the patient being transferred out of the ACF. The patient may improve to the point where he or she could be managed in the general shelter. If this happens, the ACF nurse will take the patient back to the Red Cross shelter for evaluation by the health services supervisor. A copy of all the paperwork, including progress notes, will be provided to the health services supervisor upon being admitted back to the general population shelter. It may happen that a patient deteriorates to the point where he or she needs a higher level of care. In this situation, the ACF nurse would do the following: contact EMS for transport of the client, document transfer information on the ACF patient tracking form, make a copy of this form for the Red Cross Health Services supervisor and the shelter manager. Fill out a copy of the ACF transfer form and attach copies of the patient's chart for review by receiving medical providers. Make the patient comfortable as he or she awaits pickup by EMS. Now that we have concluded this training, you should have learned the roles and responsibilities of volunteers who will work in an ACF, understand how the client-to-patient flow works within the shelter to ACF, understand and use the appropriate forms and documentation within the facility that transitions a client from one side of the shelter to the other. Thank you for your attention. We look forward to working with you.